Hi everyone. Let's continue our Chinese medicine dermatology talk. Today's topic is urticaria. During my many years of practice, I didn't think I can see urticaria patient because I thought Western medicine can control it well. There are so many medications available for urticaria, but I did see some chronic ones. We can talk about this in case the practitioners, the new practitioners, can also see this kind of situation. First of all, I would like to provide some general knowledge about urticaria. And later on, I mainly focus on the Chinese medicine urticaria. Urticaria is a skin condition commonly caused by allergic reaction that is characterized by raised red skin wheals. It is often caused by food, medication, insect stings or bites, heat, cold, or sunshine, pollen, molds, or animal benders. However, it can also be caused by emotional stress and sometimes by innocent event, such as mere rubbing or exposure to cold. I'm sure you know someone around you have this kind of condition. Some people just rub the back or rub the arm and you see raised skin rashes. It's quite common. Wheals from urticaria can appear anywhere on the body, including the face, lips, tongue, throat, and ears, and in any size from ½ millimeter to a dinner plate size. I've found some photos from website. I leave the web address here. You can have a look. There are a lot of photos in Google. You can see urticaria. See, this one is not so red with a very obvious white center. But this one is really red and skin is raised, looks very angry. And this leg, see, it's the rash are red in different shapes. And this one is a scratch mark. So it can be in different shape and different size. Okay, now the symptoms of urticaria are mainly itching and development of wheals and skin edema. So mainly itching and wheals and edema. There are two types of urticaria, acute type and chronic type. Acute type has a course between a few hours and a few weeks, while chronic type can last from 6 weeks to years. There's no visual difference between the acute and the chronic types of urticaria. In approximately 50% of patients, urticaria has angioedema coexist, while 40% experience urticaria only, and 10% will have isolated angioedema only. The difference between angioedema and urticaria is that in angioedema, the swelling occurs in a lower layer of the dermis than it does in urticaria. So angioedema is deeper. The treatment of Western medicine, I leave it to you to do self-study because there are so many informations on the internet. Now let us focus on the Chinese medicine. Now we briefly introduce the etiology and the pathogenesis. Chinese medicine has internal pathogens and external pathogens. The internal pathogens is mainly qi and blood deficiency and wei qi weakness. So what qi and blood deficiency can cause? Often it can produce internal wind. External pathogens is mainly wind. Of course, there are a few others. The wind can come from food. If you consider food as external stuff, the food, mainly warm in nature, produce heat inside the body and change to wind. So you can consider this as both exterior and internal pathogen because it turns to the wind inside the body. And the emotional stress and the parasite and so on, like we mentioned before, the sunlight or even the coldness, just exposed to cold. Emotional stress, it's has the same pathogenesis. It change to heat and change to wind. And the wind moves between muscle and the skin, then produce strong itchiness. If the external wind is stronger, and then the itchiness is stronger, but it stops quickly. If internal wind causes the wheals or urticaria, it can have less strong itching, but the symptom often go up and down, last for longer time. Very often, the exterior wind and interior wind combine together. They also can combine other pathogens like heat, cold, toxic heat, and cause different symptoms. Now, diagnosis and treatment. At the acute stage, a patient has this sudden eruption. So sometimes say, oh, what's the difference between eczema and wheals or other skin conditions? The typical character for wheals or urticaria is sudden eruption with external or internal causes. When they record, they can tell you, they roughly guess this cause. And the wheals appear in cluster anywhere in the body. It appears as raised white center, often surrounding erythema. May disappear within several hours. Some actually I experienced it, they disappear within few minutes. Or rarely, they hardly have vesicles or blisters together, but it's possible. With accompanying and periodic severe itchy and burning sensation and pain. Periodic outbreaks over a few days or emission. Treatment principle is dispel wind, clear heat, eliminate dampness, and promote sweating. The formula we modify is 消风散. I'm not going to read through all the ingredients, but we can see these lung cooling herbs, the wind expel herbs, and you can use for modify. Now, for red wheals, if the wheals are really red, even with burning sensation, we can add 生地 and 紫草. They have strong blood cooling function. If the wheals join together and affect the whole body, means very widely affected, we can add 知母石膏, which is cooling herbs, again, often used for stomach heat. For restlessness and dry mouth, we can add 黄连、竹叶、麦冬 For strong itchiness, we add 白藓皮. Okay, for chronic stage, the symptom have exacerbated remission episodes, last for several weeks, more than 6 weeks, 2 years. Generally, the skin integrity is not affected. However, red or white color bumps are most commonly seen, with some residual vesiculation and blistering possible. Continued exposure to allergen, exterior pathogen, procrastination by the patient, scratching, and secondary infection can lead to permanent skin changes. Treatment principle is dispel wound, consolidate surface, relieving itching. We use 玉屏风散 to modify. The modification is the same as the acute stage. I'm not going to repeat them. There are some exterior washes or lotions can be helpful. First one is if you can find the 紫苏叶, the raw herb or the granule, doesn't matter. You can make a wash and then wash the skin rash a few times a day, as many times you can, to expel wound, stop itchiness. We can use Colorman lotion. This is not only Chinese medicine, it's you can find them from Western medicine pharmacy as well. It's very convenient to get, easy to get. Now, this cupping function is very hard to explain. I've tried to look for a few books. I couldn't find explanation, but they do found it works. We put a few drops of alcohol in the cup, light the fire, and put the cup on 神阙, which is belly button. It's an acupoint called a 神阙. Put on a belly button quickly for 5 to 10 minutes, 3 times a day. It can achieve 96% recovery rate. Now, one thing we always do in the Chinese medicine is provide advice to patient related to the lifestyle and mental health. First of all, we advise patient to try to find out the allergen or the trigger of the problem. If you don't identify that, the problem can come and goes all the time. After you identify the pathogen, and then you can avoid the pathogen. So avoid it flare up. Or if it's caused by parasite, you can treat parasite. In Australia, a lot of people live in a farm. They live together with parasite. They have parasite in the body as well. On the skin or the environment has some parasite. Just treat parasite. Wear seasoned sensational clothes. If it's caused by cold, so reduce the chance to expose to cold. If it's caused by sunlight, and then you cover yourself well. Mental health maintenance. This is very important because stress is one of the cause for the urticaria. We can advise a patient to figure out what's the stressor, what is stressed about, and then we resolve issue, help patient to find a solution for their mental health issues. And also we can help them to find the service as well. If you know your community mental health, or you refer them to the family doctor, that's the quick way. But a lot of people can go to counselor and psychologist as well. Here's some reference books. So now our Urticaria talk is finished. Thank you for listening. I'll see you next time. 谢谢，再见。